It is my great pleasure to welcome everyone to this week 6 discussion group. This is the last time we will be meeting in the context of this course. So 21st November 2017. And I see we are in lower numbers than in previous weeks, and there's probably a feeling of completion that can explain that this should be an especially exciting session, because you're finally going to present the final or near final projects that you've been working on for 6 weeks. So here we have a reminder of the ground rules, and if we could, okay, and I see many of you are already a step ahead, have typed in your city and country where you are from. And I see some hands raised, but I'm assuming that we'll get back. I'm going to lower everyone's hands, but there will be an occasion to hear directly from you about some feedback once before we get to the participant presentations. So very pleased to see Jill Milbell from WHO HQ with us, and she's indicated that Alexandra Karik might not be able to join us today due to personal reasons. So she so she has been with us throughout the course, and of course their inputs, their expertise, and their invitations extended to other WHO colleagues are much appreciated. So I have here the list of the GRISP scholars who submitted 3 peer reviews. So I want to commend all of you who have done that. And then there are also volunteers who have gone above and beyond and submitted additional reviews to fill in for the gaps of colleagues who unfortunately were not able to honor the commitment that they made to give feedback to their colleagues. So most of you did get 3 reviews, and we're continuing to push for everyone to honor their commitment, which is also a certification requirement. We are, of course, in week 6, the final week of this GRISP Scholar course. And just as a reminder, really your single-minded purpose this week is to really take those inputs that you've received from your colleagues, review the feedback, decide what you're going to improve from your initial draft, and then revise your work and submit it to the course team. So that's really the key step and the final step, and probably the most important task, because this is where you'll get to display what you actually learned that you're able to apply to your projects. And we'll be looking at the before and after version, if you will, of the projects. We expect to see substantive changes. So in some cases, we see people who change a comma here, and a couple of words there, and then submit their final version. We will see that, and we will take it into account, and that is not what is needed. You're expected to make substantive changes, so significant changes that reflect the inputs from your colleagues and your interpretation of them and your decisions, the decisions you've made to actually interpret them. Now, recognizing the exigencies that some of you are working with, we are again extending the final deadline to Sunday, so we'll be sharing some initial results on Monday and then final results on Tuesday. So that's after the course is formally over, but I hope that and I trust that many of you, given your level of commitment and enthusiasm, will still be with us. And in fact, we will be slowly publishing to the community. So let me be clear about that. It's not publishing to the whole world, but it's sharing with the community all of the projects that have been prepared in the course, and you'll see some of the feedback around that has been quite interesting. And we have been listening to the needs expressed and for more dialogue, more opportunities like this. And I know in particular Jill Milbell and Alexandra Karik at WHO have been listening attentively to these needs. So just a reminder, because we are going to be looking at certification in the coming weeks, once everyone has completed their requirements, we hope. So again, these were announced on day 1 of the course. Requirement number 1 is the creator project. So that includes 3 sort of components. The first one is the draft plan. The second one actually is the peer reviews that you do. And then the final version, the revised activity plan. So that's, those are the key requirements, and I would say that's the most important one. But we're also going to be looking at your participation in the community dialogue, so the week one activity, and then commenting on the week one activity, and then looking at your attendance in a weekly discussion group. And I must say that that requirement number 5, remember that if you are not able to attend, you are expected and required, in fact, to complete a catch-up task. And if I've been looking at the updates which contain the recordings and the catch-up tasks, and you did not see many people who've been, I know, have been working hard in the course, missed one or more sessions of the discussion group, and I have not seen their catch-up tasks. So if that's you, do make sure you meet that requirement as well, as it is part of what we ask for certification. All right. So I have quite a bit of feedback because we just went through 2 weeks. We did not have a weekly feedback session at the end of week 4. Weeks 4 and 5 were dedicated to peer review. So really, we wanted to ask you, and we did in the feedback questionnaire, what was your experience of peer review? And this is where we saw the highest and greatest number of green bars in response to these questions with respect to the learning objectives for the course. So we know this process of peer review where you're formulating and receiving feedback is quite a powerful one. And we're pleased to see these results. And I'm going to be delving into what you told us about your experience of peer feedback in this part of the discussion group. So these are, again, yes, the 6s, strongly agree what you told us, and you can see that over 70%, gave either 5s or 6s. Now the qualitative stuff is even more interesting. You told us how impressed you were by the quality of your work, of the work that you reviewed. You told us how reviewing peers helped you improve your own work and improved your understanding of the GRISP rubric. So yes, was a great way to share experience and had social benefits as well. The experience and new concepts on how to improve your own projects, improving your writing and technical skills, learning about the experiences of and gaining from those experiences of other countries, learning a lot, helping finalizing your project. Yes. Now, we also want to be candid about some of the limitations that some of you encountered, fortunately small in number, but I've pulled out really every single piece of negative feedback that you gave us about the limitations you found in peer review, and we are aware of them, and this is why we strive in the early parts of the course to explain the level of responsibility that you are given when you are asked to review and give feedback to the work of a colleague. So one person used the word destructive rather than constructive and was quite unhappy, as you can see here. There's also obvious differences in the level of effort and so invested in putting together a creator project that I think may have been quite jarring to people who put in quite a lot of effort. Some people found that they received very little feedback they could actually use. So this is one of the reasons why in the weekly discussion groups we really try to practice modeling what is good feedback, what is going to be useful, what is not. And then some people just made mistakes such as giving incorrect ratings, which then gives you an incorrect average rating, and these are unfortunate. So we are aware of these. We do have measures in place to identify when there are problems like this, and we encourage you to let us know. You also do have, and some of you have already been using it, the opportunity to give feedback on feedback. So whether it's because, and I would encourage you to do this, whether it's because you were satisfied with the feedback and you found it very useful, please do take 5 minutes to write a comment and share it with your reviewers. If conversely you experience some of these limitations or problems, we need, so it would be good to let them know that as well, and hopefully help them improve. So level of motivation was very high. The 2 had to do with somebody traveling and being frustrated with that. On the value of the course, some of you were quite explicit, and this was a reference to peer review as the best way to learn for adults. Another person recommended that the GRISP training be offered to every national EPI manager or officer in every country. And then one person commented that really reviewing a colleague's project was an eye-opening experience. And I think that is consistent with what we've been feeling during these discussion groups and observing in the community. Some interesting comments with respect to applicability. So, it's one thing to learn in a course. How are you able to use it? So one person said that they were already using transformative investment techniques and principles, and many others commented about specific ways in which they've been able to use or how they felt it had improved, for example, their ability to critique or review or give feedback to works. So a number of people ask for more learning opportunities like these, and I share the sentiment of already missing the course. More discussion sessions, and I do have, I understand the need, the expressed need. From in my experience, unfortunately, we do try to be mindful of people's time. It's the most precious resource, and we found that adding more discussion sessions does not lead to greater learning necessarily, but there may be other ways to continue and pursue the dialogue that's initiated in a course like this. This is what you told us in terms of support. So Hannah has been working overtime in the last couple of weeks with the peer review and the feedback process. And then in terms of support, these were some of the comments you gave us. In terms of time, by this point, I thought this was quite fair. Only a third of you considered you were spending more time than you expected to dedicate in the course, so that's quite reassuring. This is what you told us about the time of effort. Again, peer review being the most challenging part of the course, the busiest, very important and interesting. That was certainly recurring feedback that we received. And then the relevance and usefulness of the discussion groups that you also seem to preponderantly appreciate what we do in this space, which, as you can see, has been entirely free of lecture and instead has been focused on offering a platform for you to present, participate, discuss, give and receive feedback. So the overall experience, what you told us, and we'll be giving a post-course questionnaire in which you can tell us more about your overall experience, because this was about weeks 4 and 5 in principle, but you've already told us quite a few things about about your experience of the course. And I did like the idea that the exchange of ideas is additive. So you exchange ideas. We both have more ideas than we started with, and no one has lost anything. And I would say that's been that's a very interesting way to describe what we went through in this course. A different kind of learning. So insights outside the silos or across the silos to see what others are doing, helping gaining different perspectives on different settings. Those are all things that you mentioned in your feedback. That was quite enlightening. And then, as you'll see, we have some post-course activities. So I mentioned, for people who joined early, the GRISP Song and Dance playlist. You may be wondering what that is, and I'll be explaining in a minute. We'll be, of course, distributing an end-of-course survey, so that will be posted right after this group. And then we'll be issuing the certificates. WHO may reconnect for 6-month evaluation and impact follow-up, or so asking you 6 months down the line what beyond. Okay, so most of you seem to be very happy with your experience, but has it actually made any tangible difference in your work? That's what and that's the most important question of all with respect to learning, education, and training, is ultimately what impact does it have to improve your work and to improve the results of your work. So now I'm going to share the instructions to compose the so they should be the song and dance playlist. So if you'd like to listen to the playlist that was composed by last year's group. You can click on this YouTube link, but we're very interested in compiling a playlist of music from your country and or your culture that you enjoy, that you would like to share with fellow participants. Breaking bread, sharing culture is a powerful part of the human experience. We cannot sit down together in the same physical space, but there are many other ways of exchanging that would simply not be possible if we were in a room together. This is an example. So you'll see some people contributed songs on vaccination, others just contributed music from their country that they wish to share with their colleagues, and we'll be sharing the playlist in the community once people have sent us their contributions. So just go to YouTube, find the music. It'd be difficult. I'd be really surprised if you had music you wanted to share that is not on YouTube. Let me know. We have other ways of and then send us your music by whatever means you have, and then we'll be compiling that playlist. And whenever you think back to this course, you'll be invited to reminisce by listening to this music. So I see, can someone help Evody? Because she hasn't connected to the audio, so she has sent several messages saying there is no sound. All right, so for people, as you know, and this is, in a Scholar course, not everybody makes it. This is not a course where you simply attend the training and receive your certificate. So if you have a colleague that you know who was in the course but unfortunately did not make it, we'd really like to ask you to reach out to them and say, hey, it's okay. There are many people who have entirely legitimate reasons for why they were not able to persist through the course. So we'd like to know what those reasons are, and that can help us improve the quality of the support that we provide. So we'll be pushing that as well. And it's kind of tricky because obviously the people who are no longer participating in the course are not going to see a message in the community or in the WhatsApp group. So if you have a colleague that unfortunately did not make it, we're going to need your help. Yeah, and yes, indeed, it's the same problem with non-completers, just in many areas. So in response to Akachi and Bogu's question, is there a way to know what our outstandings are at this point, and to know the tasks that we have not completed? So in principle, you should know what work you have completed or not. We'll be sharing a checklist so that you can check that off in a forthcoming update before the end of this week. So I'd now like to welcome Jill Mill, and thank you, Jill Mill, for having been along with us the past 6 weeks. I believe you may have some additional learning opportunities to share, and some of these are up on the screen, but there may be some updates. And also, it would be very nice to hear from you about your observations and your remarks for the participants.
Yeah, thank you, Rita, and hello, everybody. And sorry I wasn't able to attend the session last week, but I heard from Rita that things are going really well, and we're approaching the end of the course, and some of you have stuff for other opportunities. So the list is always ever growing, and the link that you see at the bottom, which is actually a link from UNICEF, is for the different courses that we are providing for free to everybody, and there is a certificate at the end. And some courses are longer. It might take about 2.5 to 3 hours, but some of them just 15 minutes. So like vaccine monitor and microplanning, they are much smaller, and they are not coming soon. They are available. And then also we have a course on planning for measles SIAs, measles campaigns, and that's a new one that's got added to that. And in terms of other opportunities for a similar course like GRISP and an advanced course, we are in discussion with the Gates Foundation. This is a course that was sponsored by the Gates Foundation, So we are in discussion with them to see what can be other opportunities that we can offer in future, and I have updated them on the real success of these courses and how people are really benefiting from developing the community. And all these options will be discussed. And I think in terms of immunization community more broadly and not just courses offered by WHO, there is a lot of movement in offering more courses for country level staff, and so Gavi is also looking at some opportunities. And so I think next year we have your email addresses. So if we don't have any offering from WHO, we will continue to be in touch with you to inform you of other opportunities through our partners or through Gavi. So at this point, I would just say that I'm very happy with the kind of interaction that has been going on, and Rita is keeping some statistics which we will discuss with the donors and see how we can continue to provide these kinds of courses. Over to you, Rita.
Thank you very much, Jamil, and as you know, in this, thank you for these remarks and for your support throughout this course. So I have shared the feedback you were kind enough to give anonymously in the feedback questionnaire. Before we move to the participant presentations, I do want to open up the microphones so that if you would like to speak in your own name and and share your thoughts about the value of this experience that you've been through in the last 5.5 weeks, would really welcome. Would love to hear your voices and to hear firsthand your comments. So please do not be shy, and we would love to hear from you before we move to the participant presentations. So usually this group is okay, yes. Let me go to Calvin. Calvin, welcome. How are you doing, and what would...
I'm doing fine, thank you.
All right. Can you share, what would you like to share about your experience of the course and of working with your fellow colleagues for the last, now almost 6 weeks? Uh-oh, at least I'm unable to hear you, Calvin.
I think it has been a wonderful experience. Sharing. Are you with me now? Hello?
Yes, much better, loud and clear.
Hello? Okay. So I was saying that it has been a wonderful experience, though challenging. Working with colleagues, with fellow participants was really good. We got very nice exchanges, especially the feedbacks that we received from the reviewers, very interesting. And also the challenges that we are overcoming together alongside the commitment of facilitators who were always available to see us through the process. So I think, and using this new tool, Scholar, it has been something challenging, but very, very interesting. And now that I feel a little more at ease with the tool, I think it's a very good tool. So we've learned much. I personally have learned much into this planning process, how to go about solving problems. And since we are going to review our multi-year plan and also write down our annual plan for 2018, I'm really sure this experience will be very helpful for me in the planning process for the country. Thank you very much.
Thank you, Calvin, for this feedback. Dr. Mukesh Prajapati, please go ahead and unmute yourself. We'd love to hear from you. Again, before and then at the halfway mark at 30 past, we'll be going to participant presentations. Go ahead, Dr. Mukesh.
Thank you, Rita. I hope I'm audible now.
Loud and clear.
Okay, so for me, this course is exciting, and I would say it is a stimulating experience. The course has been allowed us to encourage to read, stimulate us to write, stimulate to do literature review, research, and in this collectively is helping to build up our capacity, and also making like digging out from us and bringing waste in the course. So I would describe this course journey is it's very encouraging, and it helps us a lot. Thank you.
Thank you very much. All right, let's go to Helen Nwanosike. Dr. Helen, welcome. You'll need to unmute yourself, and we would love to hear from you as well, your feedback from on
Hello,
the course.
can you hear me?
Yes, indeed, loud and clear.
Okay, good afternoon, everybody. Well, what I would like to say is that at the beginning of this course, I was really excited and everything was moving well, but I became overwhelmed towards the middle. And I really appreciate the support from the team. They're always there to encourage you. And this gave me the motivation to continue. And then the content of the course too. I think it is something that is very important, especially in Africa, because the context of immunization here, it is very low in certain areas. And if we have these transformative investments that we can use to transform the EPI in our various countries, I think it's going to go a long way in eradicating certain diseases. So I appreciate this scholar course. I appreciate the way it brings a lot of experienced professionals from all over the world to dialogue. My experience in immunization is not as strong as most of you. So I really appreciate the opportunity to dialogue with you. And I really hope that after this course, we're going to be able to keep some links, because we never know in the future. I may visit Ethiopia and I may look for whoever is participating in this course from Ethiopia. So I hope we are going to be able to keep links with one another. Thank you very much.
Great. Thank you very much, Dr. Helen. All right, let's go to Dr. Khalid, and then we'll hear from Alain Blaise. And let me see how we're doing on time. So we've got 2 minutes, but I think it's important to hear your voices firsthand, your experience of the course, and we really appreciate your thoughts.
Good afternoon, everyone.
Yes, go ahead, Dr. Khalid.
Okay, thank you very much for giving me the opportunity. I want to actually start by commenting the team for actually their job well done and the coordination. And I really appreciate the conduct of the exercise, which really motivate me and other colleagues. Really, I want to actually say that the adult learning process, which is actually well adhered and people feel as if they are in class, I think this is actually very interesting, and actually sharing experience and learning from expertise who are actually more experienced than us is really helping. And so also like the way to actually maybe root cause analysis of challenges and come up with the challenges which other people will help you in developing a plan. This is very welcome, and I really appreciate it. Thank you very much.
Thank you, Doctor, for this feedback. Very much appreciated. Let's go to Alain Blaise Tatsinku, and welcome.
Yes, thank you, Rita. Yeah, thank you, Rita. My audio is not that good, but I will try. So it was a very good experience, very good. And I think that it was a good lab for enhancing immunization practices among health professionals that we are. So first of all, I would like to give a special thanks to Rita and the support team. Your support was valuable and really professional. I really appreciate it. That makes us want to learn more. And we acknowledge your dedication for API improvement all over the world. Please keep the good work. That's well done. For my colleague, I will be thankful to them for their dedication and all the ideas that they share through the course. Please let us keep the good work. Thank you, Rita.
Thank you, and thank you for the kind words. We do everything we can to support you, but you know, at the end of the day, what you do with this course is in your hands, and it's been wonderful to see how much you've been able to contribute. So let's go to Pergaf, and then whoops. Yes, go ahead, please. You'll need to unmute yourself, Pergaf.
Yes, I have unmuted. How are you all? Am I audible, Rita?
Yes, loud and clear.
Okay. I would like to thank the facilitators and participants for the dedication to share knowledge. That is, as generally speaking, I have two things to tell. One is I have learned how to manage time. And the second one is I have gained a broader perspective on what other people think. This is most important in public health, I think. And the last one is hard work always pays. Now, coming to specific things, what I have learned is the first one is importance of data availability and usage for corrective actions. I think most of the countries, like it was discussed earlier during the group meetings also, that data is not usually available. So that at each of our levels, we can try to get as much data as possible for generating evidence and for corrective actions. And the second one is I have learned that every country has a different issue. So maybe if we know how they are dealing with, we can implement it in our country as well. Thank you.
Thank you very much, Pergaf. All right, I see one more hand raised. I also see a ton of comments in the chat. And all of these comments are appreciated, and we do save the chat transcript. Going to try to read some of them after we hear from Wajid. Go ahead, Wajid, please. Dr. Wajid Abdullah, are you able to hear us? If so, we'd love to hear from you. You may need to unmute yourself. All right, looks like, okay, so from Pergaf, this is a very fantastic idea of blessings from WHO to inform us about future courses. And Voani Cornelius, thanks for the information about the available courses and would like to participate. From Ivodi, thanks for sharing the list of trainings. Dr. Khalid, I appreciate the course and the coordination was superb. I learned a lot about the GVAP and the GRISP framework strategy, solving issues which are impediments to immunization activities. So from Friday in Coma, just like Kelvin, we will, as Zambia, be updating the CMYP this month, and the skills from this informative course will be used in this process. I do appreciate the course, and thanks for the course team and participants. From Akachi and Bogu, this course is fantastic. It is not very easy having to read through the GRISP and GVAP on your own, but with this course, you are self-motivated to complete it. I was also able to learn from other countries' experience on immunization and the strategies they have implemented that have been successful. From Jani Horace, this course is wonderful, has been a great networking opportunity, and it is a positive outlier for professional development. So as you know, the reason I read these comments is because people viewing the recording will not be able to see the comments. So from Alain Blaise Tatsinku, very good experience, good laboratory for enhancing immunization practices among health professionals. Special thanks to Rita and the support team. We acknowledge your dedication for EPI improvement. Please keep up the good work. For colleagues, thank you for your dedication. From Gebayehu Dejen, I am so satisfied with the support and facilitation. Now I'm able to prioritize the possible transformative investment that improve our immunization program. Bashir Ahmed says, no words can cover the usefulness of the course. And from Gebayehu, I learned from the peer-to-peer thing, logical and real, how things happen. From Rizwana, I learned by revising the whole project. From Envani Cornelius, the experience was very rewarding and learning from senior experienced colleagues the world over. I never knew the problems in immunization cut across borders and not peculiar to one country. Thanks for the opportunity to learn and improve my capacity as a professional in immunization activities. Wajida, I just saw your message. We could not hear you, even though your mic was unmuted. I'm not sure why that was. I apologize for that. But please feel free to type your comment into the chat. Mukesh Prajapati says, if I have to describe the course in one word, it is stimulating. Damu Ibrahim, it is great. Kudos to the facilitators, particularly Rita. Sergio Gassama, big thank you to all of you for all your support. It was a tense 6 weeks, and we appreciate that, but a worthy one for capacity development. From Tsigai Gute, I've worked in the EPI program for the last 13 years in planning and coordination, but this course is special because the course very excellent. Support of the course team is very nice. And also I appreciated peers for constructive comments. Finally, I'm very happy on joining this course. Thank you all, the course team. Dr. Mohammed Miro Salim, the course is excellent, enabling us to think in direction what the program needs from us. Hats off to GRISP facilitators, and Pranit Fatale adds, it's a wonderful experience. All right, thank you so much for all of the one more question. One more. All of these comments are amazing and worth reading. So from Fiona Atuhebwe, on top of what has been said, for me, this tested my commitment to learning. I was really busy, but I did want to complete the serious course. I dedicated time to give detailed feedback to peers, and it was stimulating. And we are aware that you are busy working professionals, which makes your performance in this course even more remarkable. Savatri Bunsavath, this is the best source of learning for me in development of the project. It will be challenging for me for the implementation in the future. All right, we're going to have to stop here so that we can hear some participant presentations, given that we are nearly finished, but really this week you're focusing on finalizing those creator projects. So we're going to call for volunteers. We did post an update, but did not get anybody posting a comment. That message was mixed up with the urgent request for peer reviewers. So I think that's why people didn't see that we were also calling for volunteer presenters for today. So if you feel ready to show your creator project and really tell us what changes you are making now that you have feedback from your reviewers now in the final week of the course. So I know it always takes 30 seconds or 30 or 45 seconds before the first volunteer raises his or her hand. Okay, and I see we did not have to wait long. We've heard from Khalid. Let's go, and I'm not sure who raised his hand first between Calvin and Khalid, but let's start with Calvin, and hopefully we'll have time for both. So Calvin, are you able to speak to us? Calvin?
Yes, I can speak to you.
Okay, great. So I'm going to make you the
Yes, are you getting me? Okay.
Yes, indeed, loud and clear. I'm making you the presenter, so you'll have to accept the request to present, to share your screen, and then if you could take us to your creator project. And you know how this works now. We'll give you 5 minutes to explain to us, focus on the activities, but also tell us how you are going to apply what you gained from the course and from the feedback from your colleagues to finalize an improved plan. So if you are ready, I shall start the timer.
Okay, thank you very much. I hope you are getting me.
Yes, loud and clear.
Okay, so my work, my transformative investment is strategies to reach, and I first of all developed a country context that was appreciated by the reviewers, especially for the maps. So here we present the country, the total population of 24,513,616, and the number of surviving infants. That is the target population for immunization in 2017 across the 189 districts of the country. The immunization activity started in Cameroon as a project in 1976 and was now operational as a program in 1982. And since then, the country is providing 12 vaccines to under 5 years old children and pregnant women free of charge. However, the vaccine immunization coverage have been on the rise till 2013. We got to the highest immunization coverage, that is 88.6%, and since then we've not met the 85%, though our objective in the CMYP is still 89%, and that is why and some analysis or from the country context text, we can see that the country is faced with many difficulties in the implementation of immunization activities, including security issues in the northern and eastern region of the country, unrest in the southwest and northwest, and also insufficient staffing and financing. So what made us to tools to select this transformative investment, that is, invest in tailored strategies that identify under-vaccinated and unvaccinated persons and regularly provide them with the vaccines they need. So it's because of this insufficient immunization coverage, we've not met our targets. And from analysis, lesson learned from national immunization days and supplementary immunization activities, we came to find out that communities, some special communities, both in rural and urban settings, who did not have good access to immunization activities. This is because of security issues, and we said poor mapping of nomads, isolated communities living in hard-to-reach areas as islands and highlands, insufficient staffing and financing. And though all 9 transformative investments are of interest for the country, we selected this specific one on tailored strategies. And for our strategies, we think 8 strategies are interesting for our country, and from these 8 strategies that are presented in our work, we selected 4. So from the justification of transformative investment, the reviewers told us draw our attention to the fact that we did not really put the encouragement. That's why in our revised version, they
Calvin, at least I've just lost the audio. I don't know if others are able to hear Calvin. I'm no longer able to hear you, Calvin. Okay, this would be unfortunate if we lost you in the middle of your presentation. Okay, Calvin, are you able to hear us, to hear me? Okay, he's offline. All right. Okay, he's gone offline. Let's give him a few seconds to reconnect. This can happen if your internet goes down or your computer crashes, or there can be a dozen reasons why this can happen. And of course, if we were all sitting together in the same room, this would be less likely to happen. But wait. All right. Okay, he's still being shown as offline. So, with apologies to Calvin due to these technical difficulties. Yeah. All right, let me go back. Now, let me call for our next presenter. And Dr. Khalid, I'm going to go to Tapas Nair because I believe we heard from you last week, if that's all right. And let me unmute. Oh, no, that's still not Calvin. Okay. Tapas Sadasivan Nair, welcome. How are you able to hear me, and are you able to speak as well?
Rita, I'm able to hear you. How do I connect my screen?
So I've just sent you the request to share your screen, and we'll need you to accept the request.
Yeah. Is it being shown on the screen right now?
Yes, we can hear you and we can see your screen. So I'll start the timer now.
Okay, just a minute. Yeah, so coming to my creative project, my transformative investment that I had selected was monitoring systems. Invest in an information system that identifies and tracks each person's vaccination status. So coming to India, India has a birth cohort of roughly 26 million children. So the immunization program in India is the largest of its kind in the world in terms of quantity of vaccine use, the number of beneficiaries, the number of immunization sessions that are organized. It's a huge exercise. So we have undergone a lot of progress over the years, and we have undertaken, in fact, when I was going through the progress that we have achieved, I was able to classify them under the various transformative investments. Like, for example, we now have a strong national team, which is really supported by the Immunization Technical Support Unit. We have undertaken a lot of activities under the strategies to reach, because we are using this PD strategy, the periodic intensification of routine immunization. We have actually branded it as Mission Indradhanush in order to target those children who are unvaccinated and partially vaccinated. We also have started preparing CMYPs in a systematic manner, undertaking midterm reviews as well, and we're currently drafting the new CMYP. The financial aspects are also being streamlined by the implementation of the project implementation plans, which is also known as PIPs. We have undertaken a lot of progress in strengthening the capacity building of vaccinators and district managers. We have devised immunization handbooks for various cadres, and we are implementing these trainings on the ground. We have also started a project on e-learning, so that's called the Rapid Immunization Skill Enhancement in selected states. So we are piloting it, and we are trying to assess its impact over the next 3 years. We have completely revolutionized the vaccine supply chain by setting up an NCC MIS, a cold chain MIS specifically. We also have a cold chain and vaccine management resource center. We have done EVM assessments, and we have also introduced this new tool called EVIN, Electronic Vaccine Intelligence Network. So that's really revolutionized vaccine logistics. We are focusing on the older age vaccinations. We have also started a bit for demand generation. So the thing that I found that was missing was the focus on data quality and the focus on the monitoring systems. So as you can see here, 3 different pictures, 3 different data sets, completely different data. So what we wanted, what I intend to do is to focus on the monitoring systems and improve the data quality. So coming to prioritization. So my initial set of strategies are mentioned here. I've selected 3 priority strategies: improve administrative coverage, data recording and collection, assessing the reliability of the reporting system with a data quality assessment, and substantiate immunization coverage data with coverage evaluation surveys. So coming to the activity planning, and for each strategy, I have a set of activities. The first activity that I've decided was training of EPI staff at all levels, developing of packages, induction trainings, conducting refresher trainings in innovative manner using demonstration, group exercises, videos, etc. Focus on the data quality aspect. So by creating a component of the supervision checklist should have a focus on data quality. So ITS has also developed a rapid data quality assessment tool. So, and we are implementing this in the field in several states. So that is a plus point. Collaboration with other stakeholders. In order to revise HMIS formats, we need to interact with the HMIS division, that's a statistics department. We also need to get better reporting of in HMIs by private sector, by private practitioners, by NGOs which conduct immunization services. So we need to train the data entry operators in the HMI system. Coming to the second strategy, my first activity would be data quality assessments. We have been conducting data quality assessments in selected states, but there has been no follow-up because the state isn't that convinced about the need for improving data quality. We have to increase that focus on data quality assessments. We need to, we have created data quality improvement plans. We need to make the state responsible for implementing those data quality improvement plans. And after a year or 2, we need to go back and check what's the current scenario. Has it really improved following the data quality improvement plan? We have also, I've also mentioned routine desk reviews as a strategy in order to train state and district immunization officers and managers in order to how to conduct routine desk review. What does it entail? What does it comprise? Can they do it on a routine basis? That would really help identify errors and create, will enable them to take appropriate action at their level itself instead of letting it go up to the national level and be detected at the national level. Then the third strategy was substantiate immunization coverage with coverage evaluation surveys. So we need to conduct a CES periodically in order to validate the administrative data, and they need to be carefully designed. And we have already got a commitment from UNICEF in our country to conduct regular CES, and they are going to do the next CES in 2018. Coverage validation is important, especially for those districts where there's a gross discrepancy between administrative and evaluated data. And above all, we need to check the home-based records and the facility-based records for validation of this data. Coming to monitoring and evaluation, I created a small framework. Some sample indicators have been mentioned. So number of states where all EPI staff are trained in proper use of HMIS formats. So the target would be all 36 states, and the state training reports would be the source. The responsible person would be the state immunization officer, and we'll follow up this indicator on an annual basis. So similarly, I have mentioned other indicators. Number of states where the supervisors are assessing data quality during supportive supervision visits. Number of states where there is nil or almost nil HMIS reporting from private sector. This will enable us to identify those states and focus improving the private sector reporting in these states. Then number of states where DQA has been conducted in the last 1 year. We would like to create a scenario where every state is motivated to conduct periodic data quality assessments, and the number of states where data quality improvement plan has been prepared. So as soon as the DQA is over, we would like them to devise an appropriate data quality improvement plan. So we'll need to follow up on that indicator as well. And number of states where regular desk review is being conducted in all districts, because we have a very extensive monitoring network through WHO. We will be able to get this data from every district in the country. So that is my transformative investment. Yeah, over to you, Rita.
Thank you very much, Tapas Sadasivan there. So I've been communicating with Calvin. He says, yeah, that his connection is now stable. So I know we have very little time left, and we would love to have each one of you present, and we may be holding hoping we can hold an event which would be entirely dedicated to your presentations and make it a true commencement, as I mentioned in previous weeks. So let me now go back to Calvin, and let's see, Calvin, if yeah, I'm hoping, is your connection stable now? Because
yes, my connection is stable now.
Okay, thank you. So let's pick up where you left off, good that you were able to make it back online. Go ahead, please.
Okay, thank you. I was presenting my priority strategies. The first strategy was identifying and examining reasons for unvaccinated and undervaccinated. And this is because if we don't find root causes of problems, it is difficult to solve them. The country is a very diversified country with about 240 tribes, various religions and languages. So it's very important we understand what are the key determinants for unvaccinated and undervaccinated children in order to address them. The second strategy is to revisit target population estimates. Most districts receive their population targets from the ministry, which is administrative population, and do not always match the reality in the field. And from this, we have it results in poor decision making, wrong planning, and during the monitoring process, it's very difficult to take good decision. For strategy 3, we choose update micro plans to ensure that all communities are included and targeted within session plans. In our context and justification, we talked of this special community living in isolated area or other communities that are in area facing insecurities. So it's very important to develop specific strategies to cover this special population, and we can only do this by updating microplans and mapping the unreached or underreached children. And finally, we wanted to revitalize and provide adequate resources for outreach services, because after planning, many districts plan outreach strategies, but because of poor staffing and poor financing, they are not able to implement the outreach activities that they plan, and finally we don't have the expected results. So the activity planning, each of our strategies were developed into activities. And first of all, for the first strategy, that is identify and examine reason for undervaccinated, we propose a survey on determinants of on vaccination and undervaccination, which will be carried out by a specialized cabinet. And the second activity is a workshop for analysis, validation, and comparison of survey data with routine immunization. From this workshop, we will come out with significant causes for each health district, why they are not well covered. And finally, regional workshop for disseminating survey results and training on root cause analysis approach of district managers, team members. So second strategy, we propose as activity a desk review to identify health district presenting issues with target population, then conduct local head count on children under 5 years of age in selected health districts. And this will be done either by mobilizer during NIDs or other supplementary immunization activities, or in districts who are, which are implementing performance-based financing. It can be done during home visits. Finally, register all home deliveries by village to follow up the target population. Strategy 3, we propose to train district management teams on RED approach and micro-planning at regional headquarters. Then health facility managers and EPI focal person will be trained, and they will come out with micro plans from health areas to health district and a consolidation for the region. And finally, in order to revitalize and provide adequate resources, we will do a mapping of all communities to be covered through outreach, planning of outreach activities, and we will secure funding for the implementation of outreach activities. So here, the feedback I received helped me to improve on the strategy 1, because I was still analyzing data during the workshop. So my reviewer proposed that I should the analysis should be done by the cabinet, and that was very right. So I adjusted my work according to the suggestion of the reviewer. Now for monitoring and evaluation, we have an annual work plan, and 9 out of the 12 activities we propose are encompassed in our annual work plan, and can be thus the monitoring framework in the plan can be applied for these activities. And the 3 remaining activities can also be followed up in the same way, that is data analysis, monitoring meeting, as we usually do in the EPI system in our country. So monitoring meetings are held at all levels, periodically, be it monthly or quarterly or 6 monthly. And from this monitoring meeting, we come out with monitoring reports that are shared at lower level and also sent to the hierarchy. So the key determinants we propose to follow up are proportion of health district having an updated EPI micro plan for the current year, proportion of outreach session implemented, GPT-1 coverage, GPT-3 coverage, and finally proportion of health districts with GPT-3 coverage higher than 80%. So this is the work that we propose, and I would like to thank all the reviewers for their relevant observations that are being taken into account in the revision process of this project. Thank you very much.
Thank you very much, Calvin and Tapas, our 2 presenters. I wish these sessions could be longer and than they are, but I'm also aware that you all have professional work that is undoubtedly waiting for you. So I'm glad, Calvin, you were able to present some comments in the chat from Alain Blaise at Sinku. The work done in India is awesome. Lots of strategies implemented to take here. I would love to see the outcomes of these innovative strategies, especially e-learning platforms for health professionals. Thank you for sharing with us. Calvin Tonga says, I can understand the challenges with a large country as yours. I really appreciate the format of your work. Logical, precise, and concise. Well done. Alain Blaise says, good, Calvin. Then Tapas Sadasivan says, thank you, Calvin and Alain. This is the advantage of this platform. We are able to learn from the experiences of various countries, and we'll be able to implement best practices that we have heard about. Alain Blaise says, well done, Calvin. I do like the strategy to conduct microplan in your districts, especially difficult districts. Lessons learned to share during and after implementation. Thanks a lot. And then Khalid, well done, Calvin. Good work. Mimi, thank you. Mimi Lamu Mainak says, thank you, Calvin and Tapas. Sarjo Gassama, well done, Calvin. Muhammad Murad Salim, I actually enjoyed all the presenters. Well done. Tigay Gute also thanks and commends the presenters, Savatri Bun Savath, Damu Ibrahim, and Radija Filipov and Bashir Ahmed. So, and Radivaj adds, it is a pleasure to be a part of this course. So all good things must come to an end, but we have heard your expressed needs and the appreciation you've showed for this kind of activity, this peer learning that connects practitioners from different countries, from many different countries, from all over the world to each other. And I look forward to seeing how we can take this forward. So I want to thank all of the participants and commend them on their amazing work, the team from WHO and the team from LSI. And that's it for this session. But remember, you do have to, by the end of this week, of course, submit the revised work, the final version of your plan, showing substantive improvements, and that is how you will actually complete all of the requirements in the course. If you have any questions about the requirements, we'll be sending out the checklist, as I mentioned, and if you need any support whatsoever in catching up on any of the required tasks or have questions about the course, you know how to get in touch with me and with Hannah, and you're definitely encouraged to do so. Thank you very much. Wishing you well. I'm now going to unmute everyone so that we may greet each other in this way for the last time, at least for now. Take care.
Thank you.
Thank you so much, Rita.
Thank you very much.
Thank you for PowerPoint.
Thank you, Rita. This is Jenny Horace from London.
This is to everyone. Bye.
Thank you very much. Thank you and goodbye.
Thank you.
Thank you and goodbye.
Thank you so much. So nice to meet you, experts. Nobody. Thank you.
Yes, I am.
And Rita, you are great.